അല്ല മറ്റേ പറഞ്ഞില്ല എന്തായിരുന്നു?
So good morning, everybody. Am I audible, Ms. Vinisha?
Yes, ma'am.
Yeah. I think we can start. If the just check with the resource person, speakers, and
Yes, ma'am.
Yes, madam.
yes. Shall we start, sir?
Yes, ma'am.
You
Yes,
are
ma'am.
ready there. Okay.
Yes, yes.
Yes. Okay. Yeah, Ms. Vinisha, you can begin.
Yes, ma'am. Good morning, all. I am delighted to welcome all of you for today's session. We appreciate all the participants for joining us for today's webinar. I am Vinisha Priya Chauru, Assistant Lecturer, Tejasvini Nursing Institute, Kudupu, Mangalore. Dear friends, we all have mental health, and it's just as important as our physical health. Mental health problems range from the worries we all experience as part of everyday life to serious long-term conditions. There is a stigma attached to mental health problems. This means that people feel uncomfortable about them and they don't feel about them to talk much. Many people don't even feel comfortable talking about their feelings. But it's healthy to know and say how you're feeling. Before we begin, participants kindly note following instructions. Kindly mute your audio during the session. Queries to be posted in the chat box. Feedback link will be provided at the chat box at the end of the webinar. Now, without further ado, we will come to our speaker of the day. Today, we are pleased to welcome Mr. Renchular Esudaran, very special guest from Manipal. He is currently working in Manipal College of Nursing. To add more credits, he is a coordinator for MPhil Nursing and coordinates UG and PG courses in Manipal. And he has greater interest in research and has published with both national and international journals, having a vast experience in theory and clinicals. His area of expertise and interest includes mental health nursing, research methodology, and intent to carry out researches pertaining to sleep disorder, intellectual disabilities, and also health and behavior, etc. It's a proud and privilege to have you today as a speaker of the day on the topic mental health for all, greater investment, greater access, everyone, everywhere. We would love to hear from you. Over to you, sir.
Sir, I think your mic is on mute.
Oh, sorry.
Yeah.
Thank you, madam. Thank you, madam. I would like to take this opportunity to thank Professor Bridget De Silva, Principal, Tejasvini Institute of Nursing, and her team, and wishes from Manipal College of Nursing too. I will share my PPT. Can you just give me a feedback whether it is visible?
Yes, you're clearly visible. You share the PPT, sir. We'll see it. Your audio also is clear. Yeah, it's very clear.
Yeah. Okay. Very good morning to all. Have a wonderful day. And Is it visible now? Is it in full mode? Uh,
Yes, it
yes.
is visible. Full screen it is, yes.
Yeah. So we will go back to a journey 20 years back. So 2001 onwards, before that, even before that, World Health Organization is observing mental health today. But I will go back to a journey from 2001 onwards, last 2 decades. So in 2001, they have the theme Stop Exclusion and Dare to Care. And subsequently, there will be effects of trauma and violence on children, emotional and behavior disorder of children and adolescents. In 2004, the relationship between physical and mental health co-occurring disorders. And in 2006, building awareness, reducing mental illness and suicide. And 2005, it is mental and physical health across lifespan. In 2007, mental health, a changing world, the impact of culture and diversity. 2008, making mental health a global priority. And coming to 2009, mental health in primary care, enhancing treatment and promoting mental health. 2010, it was mental health and chronic physical disease. And in 2011, this is the period, the last decade, the great push in investing in mental health. See, why I told all this last 20 years, trying to tell all these themes of mental health today. In 2011, WHO actually started to push the mental health. It has to, they were advising every people to invest more and more in mental health because in 2011 time, they felt a need of improving the mental health services. So there were a lot of discussions happened. The countries have come and ratified the various documents, and in 2012 they have observed mental health day with the theme depression a global crisis. In 2013, this is a very significant year. In 2013 they have again come with mental health and older adults. 2014 living with schizophrenia, and 2015 they have a theme of dignity in mental health. 2016 psychological first aid, and in 2017 mental health in workplace. 2018 young people and mental health in changing world. 2019 mental health promotion and suicide prevention. See why I told all these things. Now last decade, 2011 to 2019, I think some disturbances are there. Participants, please mute. Um, the last 10 years, there were a lot of development happened, and the WHO also came with a plan from 2013 to 2020. And there are n number of things they were listing out to complete by 2020. We will come to know a little later. So, what is 2020 World Mental Health Day theme? It is mental health for all, greater investment, greater access. So, the work that conducted last 20 years that will yield the result now. So, what are the work? What are the activities? What are the plans they were formulated to achieve this major initiative? So 2011 they started it. 2020 they want the result, and unfortunately the results are not that good. So they are extending it to 2030. So we will see all these things. So I will quote a statement made by the president of World Mental Health Federation. Mental health is an investment and not an expense, and should be prioritized to avoid a further catastrophe. We know, in this COVID time also, the post-COVID time will be very challenging to us. Now we are not having bed for treat the patients who are COVID, but this will be more challenging to us once the COVID is going, there will be a lot of depression, a lot of suicide, a lot of mental health problems are yet to come. And we will face the same situation after the COVID, that we will not have enough facility to treat the patients who have mental problems associated with COVID-19. So we need to invest, we need to utilize our resources judiciously, and also we need to attract more and more finance, also human resource to the field of mental health. When talking about mental health for all, greater investment, greater access, what is the need? Two fundamental questions will arise. Are we prepared for this? Are we ready to invest in mental health? We need to really think about this. Are we prepared for this? There were a lot of initiatives were taken by WHO. A lot of initiatives were taken by government of India, and this is documented also. So I will go through few documents, few steps which have taken by government of India for achieving the current theme which WHO have put. Before going that one, I also want to tell you about mental health action plan of 2013 and 2020. Then only I can come and tell you about the initiatives which were taken by government of India. So the objectives of mental health action plan 2013-2020 to strengthen the effective leadership and governance for mental health, and to provide comprehensive, integrated, and responsive mental health and social care services in community based settings, and to implement strategies for promotion and prevention in mental health, and strengthen the information that the number of suicides happened, number of mental illness happened in the year, that has to be given to the WHO. These are the major objectives of the mental health action plan in 2030 to 2020. So in 2020, that's the current year which we are talking about, we have to achieve certain global targets. So what are the global targets we need to achieve? Target number one, 80% of the countries will have developed or updated their policies, plans for mental health in line with international and regional human rights instruments. Target number two, 50% of the countries will have developed or updated their laws for mental health in line with international and regional human rights instruments. Target number two, service coverage for severe mental disorder will have to increase by 20%. That means that extra 20% we need to achieve. The care facilities should reach to 20% more people by 2020. Target 3.1, 80% of the countries will have at least two functioning national multi-sectorial promotion and prevention programs in mental health. Global target 3.2, the rate of suicide in countries will have to reduce by 10%. Global target 4, 80% of the countries will be routinely collecting and reporting at least a core set of mental health indicators every 2 years through their national health and social information. So these targets are very much important. So one thing which we need to see, we need to update our laws. We need to update our policies. If we don't have a policy, we have to make a policy, and we have to change the way we are assessing the facilities. So government of India taken a lead role in developing a mental health policy, and as part, if we were knowing about the Mental Health Act of 2017, prior to that, a mental health bill was introduced in Rajya Sabha in 2013, and based on that, there were a lot of discussions were happening, and policy was again, formulated based on the discussions in 2014. And after the policy development, which happened in 2014, NIMANS have started a mental health survey. It was started in the year of 2013, and it was completed almost in 2014. and the report was published in 2015. So the mental health survey have given a lot of ideas, a lot of facts regarding the amount of problem which we have in India, amount of mental health problems and associated factors in India. And with all the data available, we went to the new law or new act, that is Mental Health Care Act of 2017. There were a lot of small activities happened in between. There were numerous discussions were happening. So we will today discuss few of the facts with, associated with the result of National Mental Health Survey 2014. So, what are the objectives of this survey? Estimate the prevalence and pattern of various mental disorders in a representative Indian population. Identify treatment gap, healthcare utilization, disability, and impact. Assess the current mental health services and systems in surveyed states. So, I will be presenting few of the statistics which get as a result of this survey. Coming to the prevalence of mental disorders, the overall prevalence of this one is 10.6. That means at any point of time, the prevalence of mental disorder, at any point of time, 10.6 percentage of our population is having a mental disorder. And going to little details of that one, if you see that the mental disability is 10.6 and some common mental disorders are, if you see that this 10.6 includes severe mental disorders and common mental disorders and mild mental disorders also, anxiety and all other disorders also. So if you see common mental disorders, 10 percentage of the population is having common mental disorders. Okay, so what is the impact? The impact, if you want to see that, we have 138 crore population, and if you see at any point of time, 10.6 percentage of the population is having mental illness, severe mental illness. That means that 14.62 crore population at a time is affected with mental illness. This is a very huge number. Do we have the facilities to take care of this much people? Do we have drugs available to give to this much people? Do we have enough human resources to take care of the people? When 14.62 crore people are having mental illness, that means that 14.62 families are also having mental, they are suffering from the illness. If a person in a family is suffering from illness, the entire family is also suffering from that, problems associated with that illness. So in India, 14.62 crore families are suffering uh, because of the problems associated with mental illness. Are we ready for health for all? We need to ask the question. Coming to the productive age group, okay, 18 to 29, definitely it is productive. I'm not telling they are not productive, but most of the working, people in India is from 30 to 49, and to an extent we can go up to 59. That include retirees also. If you see the prevalence of mental illness in 40 to 49 age group, 18.4 percentage of the individuals are suffering from mental illness. This is a very high number, and this is going to affect the productivity of the country. When 18.4 percentage of the productive population is suffering from mental illness, this is going to affect the economy of the country. So we need to tackle this. That is why WHO came with a plan for mental health for all. Coming to the prevalence of substance abuse and suicide, 20.9 percentage of the population is having or using tobacco as a substance, and zero point 0.6 having other substance. And I have to tell about alcohol. 4.6 percentage of the population is using alcohol. This is a documented one. This is documented use of alcohol, and it will be definitely more. Uh, they don't have once in a lifetime they may use alcohol, or sometimes occasionally they will be using alcohol, and they may not be problematic. They don't have severe physical illness also, they are not documented. Okay, these are not documented, and documented figures are for 0.6 percentage. And coming to other substance, cocaine, marijuana, hashish, and all those, 0.6 percentage of total population is using that one. That is a very great number. And if you go to the details of that one, there was a study conducted by Ministry of Social Justice and Empowerment in 2019 nationally about 14.6 of the population between 10 to 25 years of age uses alcohol. The numbers are very great. Cannabis and opioid are the next commonly used substances. Yeah, about 2.8 percentage of the population, that is 3.1 crore individuals are using that. Basically, that National Mental Health Survey has conducted in almost around 13 states. So this is not covered the entire India. So the it is converted into weighted population. So the numbers definitely will change, and this is a recent study, and you can see the amount of individuals, the number of individuals who are using these, substances which are prohibited or illegal in India. So that is the, this is the stage we are. We need to stop all these things. Coming to the treatment gap for mental disorders, again, I need to tell you what is the treatment gap. There are people who are diagnosed who have mental illness, but they are not getting treatment. There are people who have the illness but not diagnosed, not getting treatment. And there are people who are diagnosed and getting treatment. Now I will tell what is treatment gap. Treatment gap is the amount of people who are not diagnosed but having illness, and people who are diagnosed and not breaking treatment. Coming to the BPAD, bipolar affective disorders, 70 percentage of people are, or 70 percentage is the treatment gap. It's very huge. And psychotic disorder 75.5, major depressive disorder 85.2, neurosis 83.2, and alcohol use disorder 86.3. Overall, if you see, the treatment gap existing is 28 to 83 percentage, and alcohol having the more treatment gap, which is 86.3 percent. People are not going and taking treatment for alcohol use disorders. That is 86.3 percentage of people are either they are not aware about the ill health associated with the substance use, or they are aware about but they don't want to stop it, or they cannot able to stop it. That is the condition. So the range of treatment gap is 28 to 83 percentage. That is also very huge, and the resources available, if we want to give treatment for all, that is we cannot think about it. It is very challenging. So we will come to the resources available. Okay, some of the states which is coming under this survey, it is Assam, Chhattisgarh, Gujarat, Jharkhand, Kerala, Madhya Pradesh, Manipur, Punjab, Rajasthan, Tamil Nadu, Uttar Pradesh, and West Bengal. These were the states the survey has been conducted, and they have generalized to the entire Indian population. So the amount of psychiatrists you can see, it's the number of psychiatrists you can see, and the clinical psychologist number you can see, and the psychiatric social workers uh, per lakh population you can see how many are there, and the numbers are very less. It range from 0.6, 0.8 per lakh population. So this is very difficult. We cannot handle the number of patients who are coming to our hospitals. Hospitals are less. People are having very difficulty to reach hospitals. It will be, they have to travel a lot, and a particular psychiatrist have to see almost around 500 to 600 patients. Okay, what care we can give? Okay, um, it will be very difficult. They can just brief that one. They can see the what drug they are getting, and they will uh, prescribe the drugs, and they will go back. There is no in-depth consultation when the number of people are more. Okay. So what is uh, our how is our facilities? Okay, in 1996, NHRC, National Human Rights Commission, they have published a report. In that report, they were mentioning about government hospitals. and there were 37 government hospitals with bed strength of 18,918. We have seen that, how many crores of population, almost around 10 crore of population is having problem, and we are having only 18,918 beds. And subsequently, NHRC along with NIMANS conducted a review in 2018, and they found that the overall, hospital, if you see the ratio of beds, one patient, actually if you calculate like that, 1 is to 1.4, that means one bed is for 1.4 patients. That means that at that point of time, patients were using floor to sleep. There were beds are not available. All the medical and psychiatric hospitals were filled. Medical hospital in the sense the clinics of the medical hospitals or the wards of the medical colleges were filled. The trained psychiatric nurses were present in less than 25%. And nowadays also the situation is not much changed. It is almost around 30% or something till uh, 25 to 28, we can say. In 2013, NHRC petitioned the Supreme Court. They want to intervene in the problems in this area of mental health. And in 2016, a four-member technical committee comprising of three psychiatrists was constituted, and they conducted a review in 2016, and they found that the bed strength has been reduced to 18,307. So where we are going? Are we giving more facilities to our population, our citizens? The number of hospitals have increased, but the number of beds in these hospitals have been reduced due to multiple reasons. Previously the patients were not giving bed; they were sleeping in the floor, and all those things. That nowadays it is not possible with the involvement of National Human Rights Commission and all those things. So we are not actually having much facilities for our citizens. Coming to the district mental health program since 1996, it is there. The district mental health program has been the implementation arm of National Mental Health Program. The proportion of district covered by DMHP is ranged from 13.6% in Punjab to 100% in Kerala. This is only the picture of the states where the survey has been conducted. What it means that one? See, in every district there should be a facility for the people, a mental health facility. But you see the percentages in the Punjab, 13.6 percentage of the districts only have a mental hospital or a mental health clinic. Whereas in Kerala, it is 100 percentage, whereas in Madhya Pradesh, it is reaching to 70 percentage. Tamil Nadu, it is going to 80 percentage. So there is a lacuna, there is a difference, there is a gap existing. Our people, our Indian population is not getting adequate facilities, even though the programs have been implemented by Government of India through National Mental Health Program and District Mental Health Program. We need to think, are we ready for all? Mental health financing. If you see the budget of Government of India, the budget allocation for mental health is 1% or less than 1%. Much of the allocated budget for mental health was spent on staff salaries, and it is not going directly to patient and the families of the patient. And some states, they were unable to utilize even the available funds due to lack of clear mechanisms and guidelines. So, Business Line article was published in February 4, 2020. In the financial year 2019, the budget allocated to NMHP was almost around 40 crores, and it was 50 crore in 2018. So 10 crores have been reduced in 2019. And in budget in 2020, there is a change, overall change, there was an increase. But if you compare the increase in the health sector budget, it saw a increase of 7%, but overall increase in national mental health program is very less. It is only 0.05% increase when comparing to the 7% increase in the healthcare budget. So our governments are also equally responsible for having little bit of responsible for the slow growing of the mental health activities. But there are a lot of plans are there. There are a lot of initiatives are there. A lot of programs are there. But we need to streamline it. We need to cross the gap between investment and development. Health insurance coverage. This is one area where people were asking for a long time that mental disorders also need to be eligible for insurance, health insurance. And IRDA recently issued a statement to the order number, C 177/9 of 2019. It says that by 1 October, the 1st October 2020, all the insurance agencies have to remove the particular disorders from the list of exclusions. That means when these disorders which I have put it in the right side, these will be excluded from the list. That is treatment of mental illness, stress or psychological disorders and neurodegenerative disorders. Previously, it was in the exclusion. If the patient is suffering from this disorder, they will not get health insurance. Now, from 1st October 2020 onwards, these disorders are also considered for health insurance. Those include puberty and menopause related disorders, age related macular degeneration, behavioral and neurodevelopmental disorders that include disorders of personality, disorders of speech and language, including stammering and dyslexia. So this is a great move by Government of India. So there are a lot of people will be benefited by inclusion of these disorder in the eligibility criteria of health insurance agencies. So are them all mental illness required to be insured? Yes. All mental illness need to be insured, but these are only the exclusion. We will see in the future years that other mental disorders are also excluded from the disorders. Currently, if you see dementia, Alzheimer's disease are not eligible for uh, health insurance, so we will have to wait and see what will happen. Coming to the public awareness activities, current mental health education activities are isolated, sporadic, and invisible in nature and lack of focus and direction. If you ask me, we are also doing this one. We will give education to our patients. We are conducting social dramas. We are going to outreach programs. But whether it is in a uniform way, whether it covers all the population of India, no. So it is this invisible in nature basically. So we need to improve the public awareness activities. So again in the survey they have asked in a 10-point scale what are the public awareness activities they are conducted. States like Madhya Pradesh, Kerala, Gujarat, they all have scored 5 out of 10. That means that 50% of the activities they aimed what they planned in conducting. But states like Manipur, Punjab, Rajasthan, Tamil Nadu, Uttar Pradesh, Assam, they were conducting only 30% of the activities which they planned. And the budget which is allocated for giving awareness to the public is also very less in these states. Medication availability is another major concern in India. As per a study by using WHO AIMS, study conducted in Gujarat and Uttarakhand, and you can see the medication availability in Gujarat it is 77.5 percentage, and in Uttarakhand is 25 percentage. That means what? Only 25 percentage of the medications which is prescribed to the patients are available in Uttarakhand, and 77.5 percentage of medications only available in Gujarat. This is a upper and lower values. So almost all other states, the values are coming in this. That means what? When the patient is very poor, they cannot able to afford the drug. They have to pay a lot of money. The government supply is very less. In government hospitals, when we go, the medications may not be available in government hospital, and they have to go to a private pharmacy to collect the medication. And most of the families are having difficulty in getting the medications. So overall, if you see the medication availability in India is less, it is only about 75 percentage in almost all the states, almost 75 percentage. States like Manipur, states like Kerala, they have reached up to 90 percentage of medication availability. Coming to the supportive legislations, to achieve the target by 2020, India, already I have told India have come with a new act. This act is called Mental Health Care Act. A few provisions in this act I will explain to you. If I want to explain the entire act, it will take another 1 day. So I will explain few provisions in the act. In section 18 of the act, it says that every person shall have the right to access mental health care and treatment from mental health services run or funded by appropriate government. So it is the responsibility of the government to give mental health care and treatment to the people of the state and people of India. Okay, so it is the responsibility of the government, and they all have the right to access mental health care and treatment in any forms. Okay, they should not be segregated based on caste, creed, or whatever it is, politics, or whatever it is. So all Indian citizens are eligible and have the right to access mental health care and treatment from mental health services. Section 18 and under Section 5, the appropriate government shall integrate mental health services into general healthcare services at all levels of healthcare, including primary, secondary, and tertiary health care. See, that means, when a patient is going to a CHC or a PHC, they should be treated with a medical professional, and medical professionals should have adequate knowledge in treating mental disorders. And medications also need to be available in CHCs and PHCs. And under Section D, 18, Section 18, 5D, it ensures that no person with mental illness shall to require to travel long distance to access mental health services, and such services shall be available close to a place where a person with mental illness resides. If the person cannot travel, or if the person travel with his own expenses, government should pay the expenses for his travel. That is also important. So it is a responsibility of the government to give facilities to citizens, and when the citizen cannot access the mental health services, if he wants to travel, the government has to pay the money and see that the person is getting that particular mental health service. Under Section 29, the appropriate government shall have a duty to plan, design, and implement programs for the promotion of mental health and prevention of mental health in the country. So, all the awareness programs, all the programs which improve the mental health is the responsibility of the government, and it is given by the Act under Section 29. And there is a change in IPC 309. IPC 309 is the clause where it, when a person commit suicide or attempt to commit suicide, especially attempt to commit suicide, and a case will be registered against that person. So, Section 115 of the Mental Health Care Act, it says, notwithstanding anything contained in Section 309 of IPC, any person who attempts to commit suicide shall be presumed, unless proved otherwise, to have severe stress and shall not be tried and punished under this said code. So it is basically we are not giving an extra stress to the patient who attempt to commit suicide. The suicide may happen because of the stress, and they will be free from punishment. Okay, so this section gives a change, and this section will reduce the burden of the patients also. Coming to the NDPS Act, Narcotics Prevention Act, and other substance prevention, there was another important section has been introduced recently, that is 64A has been introduced, that is immunity from prosecution to addicts volunteering for treatment. Previously, whenever a patient is getting admitted, a case was charged against him, but this section under 64A, it gives immunity to patient that he will be. This only will give once in lifetime that the patient will not be charged. So, what do you think? Are we prepared for this? Are we ready to invest in mental health? We have set the stage for development. We have set various policies. We have set various acts. We have conducted the survey. We understood the facts. We know how much is the rate of illnesses, prevalence of illnesses. But are we ready for further investment? I say yes, we are ready, but we need to do a lot of activities further to improve the mental health of all. So coming to the SDGs, SDGs should be achieved by 2030. And as far as mental health professionals are concerned, goal number three, good health and well-being, is one of the goal which we need to achieve by 2030. By 2030, reduce by one third premature mortality from non-communicable diseases through prevention and treatment and promotion of mental health and well-being. There is another target 3.5. It requests that countries to strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. So by 2030, we need to achieve good health and well-being. And when we want to achieve good health and well-being, our mental health and mental well-being also need to be considered. So that is why we have two targets to achieve. Target 3.4 and 3.5 we need to achieve as per SDGs. And WHO also have special initiative for mental health which need to be completed by 2023. So that is the universal health coverage of mental health. So what we need to do is scaling up of quality interventions, services for individuals with mental conditions, which include substance use and neurological disorders. There was a 13 general program of work which says a triple billion goal. So why we need to have a special initiative for mental health by 2023? We need to achieve the triple billion goal. So what is a triple billion goal? It is 1 billion more people benefiting from universal health coverage, 1 billion more people better protected from health emergencies, and 1 billion more people enjoying better health and well-being. So if you see that 100 million people need to be covered by mental health to achieve 1 billion more people benefiting from universal health coverage. So a route map has been given by WHO. This is a WHO from the WHO website. So they have given a route map. What is the route map? There are two strategies to reach 2023 UHC, Universal Health Coverage. Action number one is the Advancing Mental Health Policy, Advocacy and Human Rights. As far as India is concerned, we have developed the policy, mental health policy in 2014, and we have a Human Rights Commission also involved in this one, and they are preparing the strategic actions. And strategic action two, scaling up of interventions and services across the community based general health and specialist settings. This is the part which we are more interested. We need to scale up the intervention and services for the people who are suffering from mental health disorders. So with these two strategic actions, this will, it will achieve the target 2023 target, access mental health care for 100 million people. So once we achieve this, again, we need to modify the strategic action one and strategic action two for another 100 million people. So with that, we are going to contribute to the triple billion targets. So once we reach 100 million people with universal health coverage, we are actually contributing to the triple billion goals. That is 1 billion more people benefiting from UST. So with the triple billion goal, there is target one will be achieved, coverage of service of mental health conditions increased to 50%. So what we have now, the coverage of treatment, the coverage of care we need to increase by 50 percentage in 2023, and there is additional reduce the suicide mortality by 15%. So these are the two targets we need to achieve. The percentage of people which we are currently taking care, we need to double it, and we need to reduce the mortality of the suicide by 15 percentage. And when it is achieved, it will achieve the target 3.4 of SDG and 3.5 of SDG, which I have explained better before. Uh, and these all lead to the vision all people achieve the highest standard of mental health and mental well-being by 2030. So what are our roles? Stakeholders, we are also a stakeholder. So what are our role? Motivate and engage other stakeholders from relevant sectors. We need to identify who are the major stakeholders. It may be the persons with mental health problems, caregivers, family members, civil society leaders, teachers. So there are a lot of stakeholders are there. We have to find out the stakeholders, engage them in the activities which will improve the healthcare of the healthcare, especially mental health. Redesign Anganwadis to cater the early child care, emotional and developmental needs of children under 6. This is also important. Our children are our assets, so we need to take care of the emotional and developmental needs of the children. So Anganwadi teachers have a major role in taking care of that. They should be trained, they should assess the development of the child, and they should report it. They should refer the child if there is a problem. So training of Anganwadi and school teachers in various key areas of child development, improving self-confidence of parents and protection against harmful behavior. Life skill education programs for children and youth outside the formal schooling system through youth clubs need to be implemented. Life skill training of high school and primary school teachers in early identification of mental disorders and learning disorders in children and adolescents, and workplace stress management programs for employees in organized and unorganized sector. Most of the time, these type of activities are happening in organized structure. We are most of the time ignoring the unorganized structure. So workplace stress is also there in unorganized structure, unorganized sector. Easy availability of reliable mental health information through media that includes social media. Encourage action to change poor living conditions such as homelessness, poverty, lack of access to safe water, then toilet and sanitation. Implement programs to reduce violence against women and children. Gender sensitization programs for all the health workers. Incorporation of Ayush system for the promotion of mental health. Implement communication programs to reduce stigma. There are a lot of awareness programs, advertisements are possible. So stigma has to be reduced, and we need to start communication programs. This we need the help and the support of the civil society also. Encourage people with mental health problems to take part in regular activities. We cannot segregate them and say that they are mentally ill. So we have to take them to the mainstream. So what all generally people will do, we have to give that opportunity to them also. Treat mental disorders on par with any other physical disorders. We cannot segregate and say we are treating mental disorders and we are only treating physical disorders. We should consider both as equally important. Sensitization of police officials and judicial officers about mental illness, rights of mentally ill, and interface of mental health with legal issues. And increase the availability of community-based rehabilitation services. And though the new Mental Health Care Act says that unless it is having good quality, they will not be able to function in. So there should be a good quality rehabilitation centers should be there, and it should be licensed also. Community-based programs to support family members and caregivers of persons with mental illness. Formation of caregiver groups with professional inputs for support. Nowadays, it is the era of social media. We can have a lot of social media groups with the caregivers, and we can have reliable information. We can share the reliable information in those groups. Reduce the gap between required and trained professionals. This is one area which we need to focus. We need to give quality education to our students. We need to train them how to take care of the how to take care of the mentally ill people as well as inculcate mental health in general public. Attract young individuals to choose mental health profession. Nowadays, the trend is people don't want to take mental health. People are moving to other areas. People are moving to the areas where they can make money. So we have to attract the young population to choose mental health area. So the standard of living of people who are working in the mental health also need to be improved. Then only more and more people will be attracted towards it. So we also have to invest a lot of money, a lot of energy, a lot of resources in these areas. Develop and implement a comprehensive research agenda for mental health. It is very difficult, and there is lot of research activities are going in other field, other healthcare areas, but when it is coming to mental health, the amount of research which is happening is very less. So we need to improve the research happening in mental health. Another important aspect is foster public-private partnership. Center of Excellence that includes Center of Excellence in mental health, medical nursing and allied health institutions, TMHP centers and research institutions. So altogether, there should be a partnership between these organizations, these institutions. Then only we can work towards the goal of achieving mental health for all by 2023 and health for all by 2030. Okay. So there is a framework. This is called WIC Health Framework. There are key determinants of mental health and themes for the action. One is social inclusion, freedom from discrimination and violence, economic participation. So when a person with mental illness is concerned, he should be included and a supportive relationship should be established. Involvement in group activities should be done. Civic engagement is very much important. This is a part of the rehabilitation process. The patient has to be engaged with general public. And freedom from discrimination and violence, valuing the diversity, we should provide physical security, self-determination, and control of one's life. Economic participation, work, education, housing, and money. These are the individual areas where we need to take care of the patient aspects, where we have to find a uh, work for the patients, like where they can go and work after the rehabilitation. We have to educate the patient. We have to see that housing activities and all those problems have been solved. Also, there should be sufficient amount of investment. When all these key determinants are fulfilled, a population, we need to see that which all the population we have to take care of. See, this is health for all, mental health for all. So all the population groups we need to consider. It includes children, young people, women and men, older people, indigenous communities, culturally diverse communities, people who live in rural communities. All those populations need to be considered, and health promotion actions also need to be done. We have to improve research, monitoring, and evaluation of activities. Individual skill development is important. Organization development is important. Community strengthening is important. Communication, marketing, and advocacy of legislative and policy reforms are also important to achieve the mental health. So once these sectors and settings are for action, housing, transport, community, corporate, education, public, workplace, academic, sports, arts, recreation, local government, health, and justice, all these sectors are involved. And once these sectors are involved in the population, which we have specified, this will create outcomes. So what are the outcomes at individual level? The individual will increase sense of belonging. They will have self-esteem. They will have self-determination and control. In organization and community, accessible and responsive organizations will be there. Safe and supportive, inclusive environments will be there. And in society, integrated and supportive public policy will be there, and strong legislative platforms will be available. And resource allocation is judicious. and people equally get the resources, not like only few states will get the resources. They will get resources equally. And when we have satisfied, like when we achieved all these areas, um, the mental health of the people will be improved, and this will lead to long-term benefits. The long-term benefits are less anxiety and depression, less substance misuse, improved physical health, improved productivity and work, home and school, less violence and crime, reduced health inequalities, improved quality of life and life expectancy. So overall, we need to see that the population we have to the population group we have to see children, young people, women and men, older people, indigenous communities, culturally diverse communities, and people in rural communities. We also have to provide mental health for all the communities equally. So this is the theme of the WHO in 2020, the World Mental Health Day theme, mental health for all, greater investment, greater access. Thank you. If you have any questions, you can ask. Before that, I will show a small video.
At the deep, the hate of the state makes very outright the fate of the great majority of the minority, not a priority, and that bothers me. Fight for the country, hungry, then dump me off to the side and try to bubble gum.
Whoa. Can I help you?
With John's mates. Is he around?
Yeah. He's over there.
Cheers, mate.
Right, John. All right, boys.
1 in 4 of us will fight mental health problems this year.
You can do this, John. We're with you.
We're with you, mate.
Having a mate in your corner can make all the difference. So if your mate's acting differently, step in.
Here we go now, the bell's down.
So it's time to change.
So it is time to change. So if any questions, just can provide.
That was indeed a great comprehensive presentation, Mr. Ranjilan.
Thank you.
Actually, you started with various milestones, history, and the government policies, what are the lacunae between various disorders in terms of healthcare, and that was really enlightening. However, there are a few questions from the delegate. I think Mr. Ashwath, Assistant Professor of Psychiatry Department, you'll divert the questions to you. Over to you, Mr. Ashwath.
Thank you, madam. We'll move on to the question and answer session now. Some questions are posted in the YouTube link and the chat box. I'd like to read out that.
I can read here why psychiatric services are not provided in PHCs.
Yes.
See, one major problem which we are facing in our PHCs and CHCs is the availability of staff, mental health professionals. See, we have tried to inculcate the training for the regular staffs, like the non-mental health professionals, like general MBBS doctors, general nursing professionals, and it is in a continuous process. But most of the PhDs does not have a qualified mental health professional. That is one of the reasons why the mental health services are not given at PhD. PHs, what they will do most of the time, they will refer to district hospitals and other specialized mental hospitals. There are adequate resources are not available. And also, if you see that the medications, PHCs and CHCs have no stock of medications, psychiatric medications, and they have anticonvulsant drugs, but they may not have the antipsychotic medications. And most of the medications are can be given by psychiatrists with the approval of the psychiatrist. So that is one of the major reasons. Some of the policies have to be changed. Some of the the vacancies have to be filled. Then definitely PhDs and PhDs can be much better compared to the individuals of different. Another question, whether any other questions? There was another question. At
Yes, sir.
present scenario of COVID-19, what are the services provided for mentally ill persons? See, nowadays, like what we are doing in Manipal, here there are telephonic consultations where there, like people when they are suffering from COVID-19, they can call us and we will give telephonic counseling. There was a dedicated team working for that one. Uh, so telephonic consultation is nowadays which is more because contacts can be reduced and all these things. Once the problem is once all these COVID-19 problems are going to like finishing, then we have more responsibilities. Then we are expecting a high like people are going to come to the clinicals. We are expecting a high amount of we are expecting a rush to the mental health wards and all this. That time we need to act in full speed. So as far as now, the counseling part only we are providing. If we have major mental illnesses, we will do a telephonic consultation and video calls and other things. Some of the very serious cases, there will be house consultations also will be there. So these are the few things which are doing in COVID-19 time. Any other questions?
Sir, what can be the nurse's role in providing access to psychiatric care to all?
See, nurses is a major stakeholder. If you see the Mental Health Care Act, they have defined the role of the psychiatric nurse. So I will not say psychiatric nurse or a nurse. Nurses is definitely a part of mental health activity. Nurses are part of mental health activities and they are major stakeholders. See, right from like give awareness about the conditions, we can educate the patient, we can educate the family members, and we can give proper care to the individuals also. Then later we are ignoring them. See, a follow-up is also generally required when the patient is going outside the hospital, how they are doing. We need to do that. That is really missing in our care. So we also have to inculcate those things into our care, and we also have an accountability of our patients. Then we can give more care to the patient. Another interventions from our side we can do is like nowadays online platforms are there. We can utilize these online platforms and we can give counseling to the individuals which suffering from mental illness or stress or whatever they are. We can even educate the general public regarding the use of substances and the problems associated with the use of substances. In Manipal, last year we have conducted almost 9 to 10 sessions. Almost 1,000 students we have counseled, and it will be continuing as a part of. It's a funded project actually from social Ministry of Social Justice. So like that, initiatives are there. Nurses can take up, and also nurses can do a lot of research. And as a part of the research, there can be some interventions can be developed, and you can implement it in the general public. There is another question: how to reduce work stress? See, be happy. One thing which always you can do. So wherever in which all situations, happiness is from our side. Stress definitely it will be there. You cannot take things to your family. Leave the stress of work in the place where you are working, and you go and enjoy with your family. That is what is important. So don't take family things to your work, and don't take work things to your family. This definitely will improve your mental health. That's one thing which I can suggest for you. Another question: any increase of cases of mental illness due to this pandemic situation? Yes, definitely. The reason I will tell you, because of this pandemic, some of the patients are not able to get the medications, so they stop the medications, especially lithium and other medication they have stopped. There will be definitely a reoccurrence of symptoms. So we can expect after this pandemic, maybe by end of March, April, we can expect a huge rush to psychiatric hospitals. The staff, there will be a huge shortage of staff by then. We are only few people to take care of patients. What is your remedy or solution for this situation, especially for students who attended online classes? I think I don't know. I cannot able to comment on this because I am also taking online classes for students. There is no remedy. This is situation demands like that. Nobody has created the situation. It has happened. So we have to adjust and we have to find a solution for that. So this is one of the solution we are doing. Otherwise, uh, it will definitely break your academic career and all this. To avoid this one, definitely online classes is a must.
I would like to add some points there. Instead of remedy, I would say that we must consider it as a blessing. In spite of all the odds, they are having a classes, and only thing they should feel happy about it. At least till this lockdown has kept them busy. Otherwise, you would have had more mental stress problems we would have
I am
faced.
thinking, I am thinking in it a positive way that
That's right.
previously we were not using much online classes and all.
Exactly.
Nowadays the situation demands it, and we are controlling. We got the mastery and all those things now.
They
I
have
am
learned
thinking,
more technology, how to do
yeah,
things in that way. That's right.
Thank you, sir, for your answers and interaction with the delegates.
thank you.
I'll hand over to Ms. Vinisha.
On behalf of Tejasvini Nursing Institute, it's my privilege to thank our distinguished resource person, Mr. Renjulal Esodaran, for not only sparing his valuable time, but also readily accepting our invitation to be the speaker of this webinar. Thank you so much, sir, for enlightening us with your analytical thought on mental health for